Your feet, something we often take for granted. They carry us through life, yet they can also be a warning sign for something much more serious. After the age of 60, changes in the feet can be a signal for impending health issues that you cannot ignore. Feet might seem like a strange place to look for clues about your overall health, but they can tell you a lot more than you think. Today, we're going to focus on 4 specific signs that you should never ignore. Signs that could indicate life-threatening issues that are often overlooked. But before we dive into these signs, let's briefly talk about why our feet are so important. They're more than just the body part that gets us from place to place. Feet reflect the state of our circulatory system, nervous system, and overall health. In fact, feet often show signs of illness long before more serious symptoms appear elsewhere in the body. Our first sign to look out for is swelling in the feet and ankles. It might seem like a normal issue after a long day of standing or walking, but persistent swelling could be a sign of something far more serious, especially after the age of 60. Swelling, or edema, can occur when excess fluid builds up in the tissues, and while this is not always a cause for alarm, it can be a sign of heart failure, kidney disease, or problems with circulation. When your heart isn't pumping blood efficiently, the blood can pool in the lower extremities, leading to swelling. Similarly, kidney disease can cause fluid retention. As we age, the risk of developing these conditions increases, making swelling in the feet and ankles a significant red flag. If you notice persistent swelling that doesn't go away with rest or elevating your legs, it's important to see a doctor. Swelling, accompanied by shortness of breath or chest pain, could be a sign of heart failure, and if left untreated, it can be life-threatening. If you're noticing these symptoms, don't wait for it to go away. Schedule a checkup with your doctor as soon as possible. Next up is persistent cold feet. Have you ever noticed that your feet feel freezing even when the rest of your body is warm? This is more than just a minor inconvenience. It could be a warning sign of poor circulation, which can be caused by various serious health conditions. Poor circulation is one of the most common causes of cold feet, and it can often be a result of peripheral artery disease, PAD. PAD occurs when the blood vessels in the legs become narrowed or blocked, reducing blood flow and oxygen to the feet. PAD is more common as we age and can lead to severe complications if not treated. The condition can be exacerbated by other risk factors like diabetes, high blood pressure, and smoking. Over time, the lack of proper circulation can cause the tissue in your feet to become damaged, and in extreme cases can lead to amputation. If you're experiencing cold feet consistently, especially if it's accompanied by pain or cramping in your legs, it's crucial to seek medical attention immediately. Early intervention can help prevent more serious complications. So if you find yourself battling cold feet often, it might be time to talk to your doctor about circulation problems and possible treatments to avoid further complications. Our third warning sign is numbness, or tingling in the feet. Have you ever experienced a pins and needles sensation in your feet? This is commonly known as paresthesia, and while it can be temporary, if it becomes chronic, it can signal nerve damage. As we age, nerve function can deteriorate, and conditions like diabetes and peripheral neuropathy can cause chronic numbness and tingling in the feet. This is a serious issue because nerve damage can make you less aware of injuries or infections in your feet, leading to complications like ulcers or even gangrene in severe cases. Numbness in the feet could also be a sign of diabetes-related neuropathy, which is one of the leading causes of lower limb amputations. In fact, people with diabetes are at a significantly higher risk for foot problems like this, and it's vital to manage blood sugar levels and address foot issues early. If you notice numbness or tingling in your feet regularly, it's important to have a comprehensive checkup to rule out conditions like diabetes, vitamin deficiencies, or nerve damage that could become more severe over time. Chronic numbness or tingling is not something you should ignore. A visit to your healthcare provider could help determine the cause and prevent further complications. The fourth sign to be aware of is changes in skin color or texture on your feet. This could include skin becoming red, purple, or even blue, or the texture becoming dry, cracked, or shiny. Changes in skin appearance on your feet can be a sign of poor circulation, especially if the blood flow is restricted to the extremities. In some cases, discoloration and skin changes can indicate serious conditions such as deep vein thrombosis, DVT, which is a blood clot in the veins, or arterial disease. If the skin on your feet turns blue or purple, it could be a sign that blood is not flowing properly. Similarly, if your feet feel cold and have a shiny or hairless appearance, it could signal a lack of oxygen and nutrients to the area, increasing the risk of tissue death or infection. These symptoms should not be ignored. If you notice persistent changes in color or texture, seek immediate medical attention. Early treatment can prevent the condition from worsening and possibly leading to amputation or worse. Don't wait for the problem to get worse. If you notice significant changes in the appearance of your feet, get checked out by a professional as soon as possible. As we age, it's essential to pay attention to the signals our bodies are sending us. Feet, often overlooked, can give us critical clues about our health. Swelling, cold feet, numbness, and changes in skin color or texture are not just cosmetic issues. They could be warning signs of serious health problems that may lead to life-threatening conditions if left untreated. To recap, if you notice swelling in your feet and ankles that doesn't go away, persistent cold feet, numbness or tingling, or changes in skin color or texture, it's time to consult a doctor. These signs could indicate conditions like heart failure, peripheral artery disease, diabetes, or blood clots, all of which are dangerous if not addressed promptly. Remember, your health is invaluable, and taking action early could save your life. Don't wait for these symptoms to worsen. Visit your healthcare provider if you're experiencing any of these signs, and stay proactive about your well-being. Thank you for watching this important video on foot health. If you found this information useful, please like, share, and subscribe for more health tips and information. Stay healthy and take care of your feet. They might just save your life.